Introduction. This study presents a case of masticatory myositis in a guinea pig, a condition that has not been previously documented in this species, although it is frequently observed in dogs. Masticatory myositis is an autoimmune neuromuscular disorder affecting the muscles responsible for chewing. The specific muscles involved include the masseter, temporal, and pterygoid muscles. The disease is characterized by difficulties in opening or closing the mouth, pain, and swelling during its acute phase, progressing to significant muscle atrophy in the chronic phase. The underlying cause of masticatory myositis is believed to be an autoimmune reaction where the body's immune system attacks the type 2M muscle fibers, although the exact trigger for this response remains uncertain. Some hypotheses suggest that certain microorganisms might mimic the structure of type 2M fibers, leading to the production of antibodies and the resulting autoimmune reaction. Unlike dogs, guinea pigs have Elodont teeth, which means they continuously grow. This can lead to greater complications related to chewing and occlusion. This report details the diagnosis and treatment of masticatory myositis in a guinea pig using computed tomography, histopathological examination, and a combination of corticosteroids and gabapentin, along with dental procedures. Study design, case report. This article presents a case report on a 3-year-old castrated male guinea pig that was brought to a veterinary clinic with a history of chronic hyperexia, or reduced appetite, and general weakness. The guinea pig's diet consisted of extruded pellets, fresh vegetables, and fruits, primarily apples, without any vitamin C supplementation. Initial clinical examination revealed significant overgrowth of the premolar and molar teeth, causing tongue entrapment and injury to the right cheek due to sharp dental points. The incisors were also overgrown, and the left mandibular incisor had a fracture. Figure 1 shows the guinea pig's overgrown incisors and the fractured left mandibular incisor. Immediate hospitalization was indicated to perform laboratory testing, skull radiographs, and a dental procedure. The laboratory tests included a blood count and serum biochemistry to assess cell morphology, urea, creatinine, aspartate aminotransferase, AST, total proteins, albumin, and globulin. Figure 2 shows the skull radiographs with right lateral and rostrocaudal views that reveals significant deviation of the right mandibular premolar and molar teeth. There was lingual angular deviation of the right mandibular teeth and buccal angular deviation of the jaws, in addition to the fractured left mandibular incisor tooth. Initially, the patient was treated with a dental occlusal adjustment, pain medication, and vitamin C supplementation. The guinea pig was discharged but returned a week later with continued hyperexia, despite showing interest in food, and a rapid recurrence of cheek teeth overgrowth. A second occlusal adjustment was performed, and the guinea pig was observed to be active, with normal waste production, and showing interest in food. Despite this, the guinea pig was unable to eat and required assisted feeding. It was also noted at this time that there was significant muscle atrophy and difficulty opening the mouth, suggesting a possible non-dental issue. To investigate further, a computed tomography or CT scan of the skull region was performed along with a punch biopsy of the right and left masseter muscles. The guinea pig was premedicated with morphine and midazolam, then anesthetized with isoflurane during the procedure. Intravenous contrast and fluid therapy were also administered. The CT scan was performed to identify changes in muscle fiber attenuation, and the biopsy samples were sent for histopathological evaluation. The histopathology of the muscle fragments was evaluated for muscle fiber necrosis, acute inflammation, myositis, cellular infiltrates, and significant fibrosis. After the evaluation, the patient was discharged with prednisolone and gabapentin for outpatient treatment. A third dental procedure was performed to address the occlusal issues, but bilateral masticatory muscle atrophy was observed at that time. The patient was continually monitored and received further treatment including prednisolone, gabapentin, and vitamin C at home. Results: blood count results were unremarkable, with normal cell morphology. Serum biochemistry results showed a significant increase in AST, a marker of muscle or liver damage, and a slight increase in globulin levels. Creatine kinase, another marker of muscle damage, was not measured due to laboratory limitations. After the initial dental adjustment, the patient was discharged with pain relievers and vitamin C. The CT scan revealed an increase in volume and a lytic lesion in the facial soft tissues, more pronounced in the left caudal maxillary area near the premolar and molar teeth. Figure 3 provides images from the CT scan showing the transverse masseteric measurements. The width of the masseter muscles was measured with the left side at 0.5 cm and the right at 0.82 cm. Generalized recurrence of teeth overgrowth was also observed. The histopathological evaluation of the masseter muscles showed slight post-inflammatory myocyte regeneration without active inflammation. Figure 4 shows photomicrographs of the skeletal muscle showing myocyte regeneration and marked chronic inflammation and interstitial fibroplasia. The guinea pig was then treated with prednisolone and gabapentin but still experienced a lack of normal food intake. A third dental procedure revealed significant bilateral masticatory muscle atrophy. Figure 5 shows the significant bilateral masticatory muscle atrophy observed during the third procedure. Figure 6 shows further images of the significant masticatory muscle atrophy 67 days after the first treatment. After 4 months, the guinea pig began to eat solid food, gabapentin was discontinued, the dose of prednisolone was reduced, and vitamin C was continued. Discussion: the case of masticatory myositis in this guinea pig is significant because it has not been reported previously in this species. While muscle degeneration has been identified in post-mortem findings, this is a unique case documenting a live diagnosis. The etiology of the masticatory myositis in this case could not be determined with certainty through histopathology. However, similar etiologies to those seen in domestic animals and infectious diseases that induce an autoimmune reaction were considered. Genetic predisposition may also play a role in the development of the disease. Given that guinea pigs have elodont teeth, continuous tooth growth can lead to secondary dental issues when masticatory muscles are affected. The pain and difficulty opening the mouth associated with myositis can prevent proper tooth wear, leading to recurrent overgrowth. The study mentioned that a previous study identified that alterations in the pterygoid muscle of guinea pigs can occur after tooth extraction, showing an uneven muscular adaptation. This can predispose guinea pigs to malocclusions and secondary tooth overgrowth. Additionally, muscle atrophy can also occur due to disuse. This should be considered as a possible cause for the clinical signs observed in this guinea pig. The possibility of a nervous origin, such as trigeminal nerve injury, was ruled out in this case due to the bilateral nature of the clinical signs and the persistence of symptoms despite treatment, and the lack of evidence of infectious, neoplastic, or traumatic causes in the clinical and laboratory findings. Even so, the authors highlight that a neurologic injury should always be considered in cases of masticatory myositis. For diagnosis, CT and histopathological analysis are considered essential. It was also mentioned that immunohistochemistry would be beneficial for observing and characterizing the immunocomplexes. However, this was not performed due to financial limitations. In dogs, a serological test exists to evaluate the presence of antibodies against type 2M muscle fibers, but no similar test exists for guinea pigs. Also, it could not be determined if the masticatory myositis in this guinea pig had an etiology in type 2M fibers. The presence of myocyte regeneration observed in the histopathology is probably due to tissue repair and a healing process after cell death. The absence of active inflammation in the histopathological report could be because the disease was already in the chronic phase at the time of examination. The same rationale can be used for the lack of contrast enhancement in the CT scans, indicating the chronic stage of the disease. The materials section lists the specific medications and solutions used throughout the study with the source and concentration of each. The authors declared no conflicts of interest and that they received no financial support for the research, authorship, or publication of this article. The article also includes references to other scientific literature that support the discussion and findings. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.